Afternoon, everybody. This is week 4 of our Taking Action for Your Health campaign. The focus this week is on women's health. Right now, you can connect directly with experts from HCA hospitals during our live web chat that's going on at abcactionnews.com/robotics. You can participate by emailing as well to robotics@wfts.com, or you can call at 813-367-0171. Earlier in the broadcast, you saw Linda Hurtado's special report on robotics in the treatment of severe endometriosis. Also this week, don't miss her special report on gallbladder removal and what happens when you ignore your body. Joining us in the studio with more, we want to get some more detailed information from Dr. Meenakshi Jain of St. Petersburg General Hospital, which I just learned is at the epicenter, really, of robotics, one of only 2 in Florida.
Yes.
And you said one of only 25 in the country?
Correct.
You are a proctor. What is a proctor?
A proctor and a mentor at St. Petersburg General Hospital is a teacher where surgeons from all over the country, they come in and they want to learn to do robotics, and we have a proctoring program and we teach them.
So you all have been able to see patients and hear the patient stories, I should say, from all over the country. What are the symptoms in terms of, is it the same symptoms for everyone? Are they very similar, or can they be very different?
The symptoms can range from very mild to very severe. However, most often when I see the patients, they don't want to complain about these symptoms because they've probably been to different physicians who've told them not to worry about them. So at every age group, it's important. In teenagers, when we have young girls who are complaining of severe cramping and pain, heavy bleeding, backache, a lot of them are treated conservatively, and if they do not get better, they are told everything is fine. And a lot of these patients end up getting tests which come back negative. The same thing happens with women who are in their 20s and 30s, or when women are in their near menopausal age. A lot of them are complaining of pelvic pain, heavy periods, cramps, painful intercourse. They're complaining of backache, bloatedness. All these symptoms are considered normal by a lot of patients and a lot of physicians, unfortunately, who think that this is just part of natural menopause.
I can't imagine that anyone would think that's normal.
And a lot of patients, when they come in and then they kind of suffer and they are told, well, don't worry about it, after you go through menopause, symptoms are going to go away. Well, a lot of times this has consequences later on. So there are a lot of minimally invasive options which are available. However, even in postmenopausal women, when they, I see a lot of patients complaining of lower abdominal discomfort, and again, backache and bloatedness.
So the important thing is to go to your doctor with an accurate list. Don't be embarrassed of all the symptoms. And you were talking about robotics being used now in the treatment. Folks think robotics and they think, oh my gosh, I don't know if I want this. How is robotics helping in the treatment of pelvic pain?
In the past, I think the management of these women was that either you lived with the pain or you ended up with a hysterectomy with a big incision, and there was nothing conservative. Now, however, with robotics or any minimally invasive option like a laparoscopy, people were able to diagnose these conditions early, even if the tests are negative. And this is what I want to emphasize, that a lot of these women go and get their tests done, their tests are negative, and they're told don't worry about it, and they can have consequences of getting hysterectomies at a young age. The benefits of laparoscopy versus robotics, and the benefits of, we used to do a lot of laparoscopy, but now with robotic surgery,
I'm sorry to interrupt. This is a great conversation that we are definitely going to continue on our web chat. So come on back on our web chat. It's going on now if you want to ask the question, and we will see you right after the break.
Okay.